How was the ICF Core Set for deafblindness developed? Creating an ICF Core Set is a careful process. Communities from each of the 6 regions of the World Health Organization are represented and included in this process. These include experts with lived experience, professionals, carers, and family members. They work together to identify the most important ways a health condition affects a person's life. Here's how the development process for the deafblindness core sets worked. In the first phase, we review the research literature. Researchers begin by studying information about deafblindness. They look at how it affects physical health, mental health, social life. This helps them understand what parts of functioning to include in the core set. In the second phase, we collect input from experts. A group of experts is brought together. This group includes healthcare workers, social service providers, doctors, therapists, interpreters, deafblindness specialists. They answer questions in an online survey. These experts share knowledge about how deafblindness affects people and what parts of functioning are most important. In the second phase, we also consider the perspectives of lived experience. People with deafblindness and their family members are included in the process. They share their experiences of living with deafblindness. Their input helps make sure the core set reflects real-life challenges and needs. The second phase also considers the perspective of assessment. One of the goals of a core set is to inform the process of evaluation and assessment when persons with deafblindness receive services. That is why we use a general version of the core set items and assess individuals with deafblindness. From this experience, we learn more about what difficulties come up during an assessment experience. The last phase is the consensus. Once these phases were completed, we combined the information and invited 26 representatives that have a variety of experience and expertise on deafblindness to a consensus conference. We met in October 2024 in Spain to discuss and choose the 218 ICF codes that best represent barriers and facilitators in deafblindness. This comprehensive core set for deafblindness is now available online at the link below.